I'm here with Daniel Shee, who is Communications and Outreach Coordinator for SCSP at Queen's. First of all, what is SCSP?
Hi, so thank you so much for having me on the show. And SCSP is the Student Community Support Program in Kingston. We're a group of students from the Faculty of Health Sciences at Queen's University, which includes medicine, physical therapy, occupational therapy, and nursing. And we've decided to come together during this difficult time of the COVID-19 pandemic to help run errands and deliver groceries to seniors around Kingston or other members of the vulnerable population who cannot go out during this time.
So when did you start doing this?
We started about a month ago, so we're a relatively newer organization. A couple of us students remained in Kingston. We want to look for ways to help the community, and we identified this as a potential need. So it's relatively new, about a month ago.
And what exactly services do you offer, and who is your target clientele?
Mm-hmm. So our two primary services include one, contactless grocery deliveries. So how that would work is that student volunteers would go out to grocery stores, pick up groceries that were requested by the person in need, and then drop them off at their door. So this way to eliminate the need for transportation of that particular person going out to look for groceries. And our second service is to provide phone calls or weekly phone calls for social support and to prevent isolation. We know that during the COVID time was all of the social isolation going on. It's important to stay connected with our peers and also to have that source of support from the people around the community. So these phone calls, which can be requested, run once a week for people who would like them. And our primary target is mainly seniors around the Kingston community and also other members of the vulnerable population. So this includes people with chronic illnesses or people who cannot go or people who are immunocompromised and cannot go out during this time.
What about people who are self-isolating, who might be otherwise possibly healthy, who've gone out of town, for example, and have come back to the country, who are self-isolating? Can they make use of your services as well?
Yeah, for sure. So people who are self-isolating and can't go out and are afraid of spreading or potentially spreading COVID, we can definitely help out with minor errands like that as well. As the main thing is our services would be contactless, so we would drop off the groceries outside the door without having to interact with the person.
Okay, and how many people are involved at the moment?
Mm-hmm. So when we started this program, we reached out to basically only students in the Faculty of Health Sciences, and initially we had around 20 people signed up, but now we've expanded to up to 60 volunteers.
Wow.
So our capacity to help people is huge. We had the idea actually because there was something in our first year medical school course that is the first patient program where we follow a member of the community with a chronic illness for an entire year. And we thought it'd be great if we could have students start reaching out to these people to see if they needed help. So we started by reaching out to those people, and then the program expanded from there.
One of the things I found quite interesting was, as medical students, you guys are already vetted and cleared for dealing with vulnerable populations. That's certainly given you an advantage in being able to supply this service, right?
Yeah, for sure. It certainly helps that we've already had our criminal record checks and background checks already completed. And this is also true for other students in the Faculty of Health Sciences, including nursing, physical therapy, and occupational therapy. They've also had all of their background checks done. So it's been great that we've been able to work with them to run the service as well.
Speaking as a medical student, how does this affect the courses that you're taking as well? I mean, medicine is a very intensive program, and you're doing this on the side. Does it keep you guys really busy, right?
Yeah, for sure. It keeps us busy, but the good thing is we have a large team, and the people who are organizing this are happy to help out in the community and to donate a bit of their time. Although it's been busy, it's definitely been manageable with all of the effort that's put in by all of myself and my peers, which I'm very grateful for.
Do you have any particular stories about people that you've helped out? The level of appreciation, or just being there for someone. Do you have any particular one that sticks in your mind?
Yeah, so definitely we've gotten a few emails saying thank you for all the support that we've given them and helping them out in this time of crisis. Just knowing that somebody was there for them in this time is, I think, very important. And in one particular instance, I know that someone wanted to refer a senior member of the community so this person worked at Queens, and they wanted to refer that member that they knew that could not go out during this time because it was very difficult for them to move in the first place. They were already wheelchair bound and at home down in Kingston. So that particular story of being able to help them out and then being able to have them realize that somebody was there for them, we think that was a great, that was really a good moment for us in knowing that we were making a difference in that person's life. And they were very grateful for that.
Right. So SCSP is one particular service. Let's talk a little bit about KHealth in general and what that is.
Yeah, so KHealth in general it was founded initially as the class project by one of the people in my class. His name's Valera Kastanov, and what it does is it helps connect students or medical students and other interprofessional students, including physical therapy, occupational therapy, and nursing, with the community through those initiatives. So it helps to found. It helps students to volunteer and to learn more about their surroundings in the Kingston community. The other things that it participates in are service learning projects where it partners up with organizations to help students volunteer. So this includes Loving Spoonful and Martha's Kitchen. And then the final thing that it also does is the academic enrichment program, where KHealth is currently working on modules that will help students that eventually we aim to use to help students learn more about the community as well. So this includes topics on homeless health, on street addiction, and other topics.
I think it was Mark Twain once said that schooling should never get in the way of your education. How does something like this add to a fully rounded education, doing something that is not strictly in a textbook or in a classroom setting or listening to some professor? How does this round out your education?
Yeah, for sure, and that's an excellent quote, and it rounds it out because I think that as future healthcare professionals, if we're all and healthcare professionals who could potentially even be working in Kingston, I think it's very important from the very early on to be able to have an understanding of the community around us and to do services like this. You can only know about what's out there and what kind of needs that the community has if you're actively involved in it. It's really hard to learn that from a textbook or studying strictly science. So having this multi-dimensional aspect of our education, or for anyone, I think, is actually very important, and it's a key component of it.
Just a little about you. Are you from Kingston, or are you from going to Queens from out of town?
I'm actually going to Queens from out of town. So I went to McMaster for my undergrad degree, and I'm originally from Brampton, a suburb that's outside of the Toronto region. However, I've been in Kingston for 2 years now, and I really love the city and what it has to offer.
What's your favorite thing about Kingston?
Now, what I really love about Kingston is definitely a smaller town, and I can see that it's a closer knit community. People tend to know each other, and then they care about what's happening. And then I see all these great initiatives that are going on. For example, Lionhearts Incorporated giving out, which is an organization that helps provide food for people in need during this COVID crisis. I think that's definitely something that I see more here than I see back in where I'm from, in a larger community like a suburb outside of Toronto and Brampton. People tend to know each other less and stuff. So that's a huge component of Kingston that I like. I like the small town and the way that people know each other, and also I like all the small businesses here. Generally, it's just a sense of community that is not found in a larger city.
Cool. So, in terms of if somebody is out there watching this and says, I'd like to take advantage of this service, how do they get in touch with you?
Yeah, for sure. So we have our email, so khealth.community@gmail.com. We also have our phone number, which you can contact us to at any time to help request services or to refer somebody who needs these services. And most notably, we run a Facebook page, and it can be found at Student Community Support. So that would bring you to our page, which has all the resources and forms for you to fill out in terms of how to get services for somebody or for yourself. And one last avenue of contacting us is through our website. So kingstonhealth.ca is another way with all of our stuff is located on and how to reach us.
Good to know. Thank you, Daniel, for doing this, for bringing something, being part of something in the community that is, I think, really important and really critical for people at this very difficult time. Keep up the good work, and stay safe.
Yeah, you too. Thanks a lot for having me on this show. I'm happy to tell you guys about what we do.